Joining us now to share her expertise is clinical psychologist, Dr. Jen Hartstein. Welcome to the show.
Thanks so much for having me. Great to see you.
Great to see you. So, Dr. Jen, how are these filters affecting us as a society, especially young adults? We're talking about women, but guess what? I see it in men as well. So it's globally.
Absolutely. And I think, unfortunately, on social media, we put ourselves out there asking for unsolicited opinions. And I don't know about you or Iskra, but I hate an unsolicited opinion. And yet Instagram and social media apps are all about that. So we are trying to meet these other standards that other people are putting out there and not embracing our own selves, not looking at how we can be. And I think you bring up something super important, Dr. Orden, which is it's not only young women, it is across the board. How do I look? What am I comparing myself to? What's the best me? And the best you is sitting in your chair, but we live in this comparison building world. And I'm seeing lots of challenge in my clients because there's this constant comparison and this constant need to compare.
Dr. Jen, in your professional experience, have you seen a rise in the number of patients with mental health conditions due to social media?
Absolutely. And I think it was happening already. We've seen increases in depression and anxiety, especially kind of since the advent of the smartphone, because all of a sudden we're carrying around a computer in our pockets at all times. So we're constantly engaged and waiting for that feedback. And we don't know how not to have that feedback anymore. We don't know how to just sit, right? So we're constantly looking to get that piece of information that is in our hands. And I think and now, especially even coming out of COVID, where we were all on screens even more, we're seeing more depression, more anxiety, more eating disordered behaviors. So they might not meet criteria for anorexia or bulimia, but there's a lot of body image, body dysmorphia, things where they're really questioning kind of how their body looks. I'm sure you're seeing this in your practice
Jen,
too.
I wanted to comment on that there are studies going on, and we're seeing it in the plastic surgery literature. They're doing studies, the effect of social media and these apps on body dysmorphia. I mean, that's something that as plastic surgeons we have to be attuned to before we decide to do surgery on somebody. We have to make that call. Are they a good candidate? Are they doing it for the right reasons? Can we make them happy, or is it something deeper inside that's going on? And you can't deny it. I mean, the science is there. They've done studies, and they go hand in hand. And that being said, back to you, Iskra. How do you think we can overcome some of these issues? What changes would you like to see?
So there needs to be more restrictions, there needs to be age limits, there needs to be warnings. I work with the National Eating Disorder Association, and they're working really hard with Instagram to give warnings to people and to help them ban certain hashtags and try and remove certain imagery that is triggering for people with eating disorders or mental health issues. But I also think a huge part of it's going to come down to parents and community and education in schools. I'm a huge advocate. I've spoken at numerous schools and colleges all around the US, and going and speaking to young people, they are fully locked in when I start talking about social media because they're intrigued and they want to know how they can cope with it. Because I've unfortunately had some heartbreaking stories. There was a 12-year-old girl who I met, and she told me her 13-year-old friend filters all of her images. They're highly photoshopped. She uses all the filters, but she gets loads of likes online. She is so obsessed getting her worth and value from that online unreal life that she's living and her Photoshop self that she no longer wants to go to high school because she's embarrassed because she doesn't look like her online profile. And that just absolutely breaks my heart. So we have to do such a huge job as a society to help young people to realize their value, their worth is their real selves. It is not likes. It is not filtered, photoshopped images. We have to come to terms with and give them that education, that their creativity, that their personality, that what they bring when they enter a room and how they support each other as friends. That's who they are. That's their value. It is not the likes.